The system of analysis and diagnosis has been the same since 1965. Now, the names of the drugs change over the years, the names of certain words change a little bit over time, but the actual method of looking at the problem hasn't changed in the last 60 some years.
Welcome to Hacks to Health, where we share biohacks to help you live younger, longer. I'm Joe Steele, and today we're going to discuss what millions are struggling with: relentless fatigue, stubborn weight gain, or a brain stuck in low gear. Your thyroid might be quietly derailing your life, but you can take control. Today, we're with Dr. Kevin Smith, a functional medical expert who's helped thousands reverse thyroid issues without drugs by zeroing in on root causes. Get ready for bold, practical hacks to crush fatigue, reclaim your energy, and thrive like never before. Dr. Smith, thank you so much for taking the time to join me today.
Thank you for having me. I appreciate it, Joe.
I was interested in talking to you because I have a lot of friends, relatives, and I notice a recurring theme, more female heavy in my life, I'd say, with thyroid issues and thyroid medications that I see on a lot of medicine cabinets and stopping by the pharmacy to pick up the prescription. And whenever I ask, I often get it's just weight gain. I'm trying to figure out why I keep gaining weight. I'm sure you've heard, obviously, a lot more than I have, but just in my personal experience. When someone's being told that it's a thyroid thing, is there anything that maybe their traditional doctor isn't really getting to the root of?
Yeah, they're missing a lot of stuff. The system of analysis and diagnosis has been the same since 1965. Now, the names of the drugs change over the years, the names of certain words change a little bit over time, but the actual method of looking at the problem hasn't changed in the last 60 some years. And so typically, when a traditional medical doctor looks at the thyroid, they're going to order a test called a TSH test. That means thyroid stimulating hormone. And they're going to order that from a local lab and measure what is considered to be the patient's level. And if it's too high, that TSH is high, that means they have hypothyroidism or low thyroid. If it's too low, that means they have hyperthyroidism or too high, like Graves' disease. Now, the difference between a traditional medical doctor versus what I am as a functional medicine doctor is that the functional medicine doctor is going to say, why do you have low thyroid? Why do you have low energy? Why do you have weight gain? What's going on inside there? What's going on in the machinery inside your body? The medical doctor they don't really ask that question. When you go to a medical doctor and you have certain symptoms, you come in with certain symptoms, they're going to put you in a diagnostic box. And if you're in that diagnostic box, they're going to say, you're going to take this drug and this drug and this drug and this drug. And years and decades of that going on, we now live in a drug culture, don't we? So there's a pill for every ill. So if you have low thyroid, then you're going to be given a thyroid drug. If you want to lose some weight, you're going to be given a weight loss drug like GLP-1. If you have constipation, if you have diarrhea, if you have anxiety or depression, if you have your hair's falling out in clumps, there's medical doctors' approach to dealing with that problem is to prescribe a drug of some kind. Now, the functional medicine doctor, which is what I am, they want to look at what could be the driving force, what could be the root cause of the problem. They're not just about chasing symptoms. We're about looking at the root cause of the problem. And that is the primary method that I do versus that of a medical.
I mostly hear weight gain, but are there ways to determine, hey, I might have a thyroid issue, something they could do maybe at home before they see? Obviously, labs are probably, extended labs like you probably do, are going to tell you more, but just kind of getting started.
Well, there's pretty common symptoms involved with thyroid. Weight gain, even with diet and exercise. Low energy, sleep problems, either insomnia or problems falling asleep or staying asleep, low libido, or if it's a woman in childbearing years, maybe she suffers from infertility. She can't get pregnant to start a family. The hair falling out in clumps. The fingernails or the toenails are cracked and brittle. There's the loss of the outer one-third of the eyebrows. Skin problems like oily skin or flaky skin, constipation or diarrhea or some kind of a GI problem, brain fog or depression or anxiety or both. You don't have to have all of these problems. You could have one or you could have more than one. And the primary way of determining this stuff objectively is to do a lab test, because you can't lie on a lab test. They're pretty much clear cut. So we send people out to the lab, we send them out to Quest Diagnostics or LabCorp, and we draw some blood and we look at the levels. One of the other problems that's associated with the traditional medical doctors is that they don't do enough testing. So they're going to look at the TSH, and if you say pretty please and you're very nice to them, maybe they'll give you a free T4 test. So they'll give you maybe 1 or 2 tests. I ordered 10 different tests because I want to see the entire metabolic landscape and see the health and function of the entire thyroid system. So it starts in the brain. You have to have enough serotonin and dopamine, the neurotransmitters, and plenty of glucose and oxygen to make the brain work. And the brain is going to stimulate the hypothalamus. The hypothalamus is where TSH is made, which is a small butterfly-shaped endocrine gland that's in the base of the neck. And the thyroid gland is going to make T4 and T3 and calcitonin. So the majority of this stuff that comes out of the thyroid gland is T4. T4 is named because it has 4 iodine molecules attached to it. T3 is named because it has 3 iodine molecules attached to it. So you have 2 different types of thyroid hormone that's produced by your thyroid gland, T4 and T3. Now, T3 is the active form of thyroid. That's the type that your body needs to make a metabolic response. And so that can go directly to your cells and energize the cells and make them run. T4 is biologically inert. It doesn't do anything. And so 93% of all of the hormone produced by your thyroid gland is T4. But it doesn't do anything. So the body wants to recirculate that back into the system to make it actually functional. So the thyroid, the T4 goes throughout the circulation, throughout your blood, and it goes into the liver. And the liver cleaves off one of the iodine molecules, making it T3. And that T3 can then be used to do your thyroid functions in your body. 20% of the hormone that goes into the liver comes out and as a different type of a chemical compound. It then goes into the gut and it's treated to probiotics and hydrogen peroxide in the gut, and that comes out as T3. So you have to have a healthy gut, you have to have a healthy liver, you have to have a healthy thyroid gland, and you have to have a healthy brain to make all the machinery work. And all of that, that's the reason why I do so many tests to find out what's going on with the thyroid physiology and where is the breakdown. Like, let's say that a person has fatty liver disease. They're not going to be able to make thyroid or T3. They're not going to be able to cleave off one of the iodines to make that. Or if they have a sick gut, they're not going to be able to make thyroid hormone out of the gut. So where the breakdown is occurring could be coming from multiple places. Chronic inflammation produces a protein messenger called cytokines. And cytokines can bind to the thyroid receptor on your cells. It can block the thyroid hormone from getting into your cells. So if you have chronic inflammation, if your body's inflamed from eating bad food choices, that can also cause hypothyroidism. But you can make plenty of thyroid hormone. Your thyroid gland can be perfectly healthy. Your gut and your liver can be perfectly healthy, but you're still not able to get your thyroid hormone into your cells to create a response. And so that's another thing that the medical doctors don't test for.
I believe you started as a chiropractor. How did that lead you to what you're doing?
My base degree is a doctor of chiropractic. And when I went into practice about 25 years ago, people were coming to see me for, headaches and back pain and neck pain and stuff that you normally associate with a chiropractor. And I was pretty good at treating that stuff, and my reputation was growing and word was getting around, and I was doing very well for myself. But every once in a while, somebody would come into the office and they'd have a problem that would go way beyond the scope of chiropractic. Like they'd have low energy, or they would have weight gain, or they would have constant aches and pains. And I couldn't figure out what was going on with them. So that led me to start going down the path of nutrition, learning clinical nutrition, to find out maybe there's a imbalance, maybe there's a nutrient deficiency, or maybe they're toxic or whatever's going on. So I took a lot of courses, a lot of seminars. I studied this intensely for many, many years. I now have a diplomate from the American Board of Clinical Nutritionists, and I've been studying functional medicine for a long time so that I can try to distill down very complicated topics in a way that Mrs. Jones on the street can readily understand what's going on. I spend a lot of time with patients. I spend a lot of time answering questions and asking the questions, what could be contributing to their problem? That is different from a typical medical doctor. Medical doctors, by the way, they're not the evil ones. Most of them are very well intentioned. They care about their patients. They want the best for their patients. But it's not the medical doctors that's sitting in the driver's seat. It's the insurance company that's sitting in the driver's seat. So by the time you even walk in the medical doctor's office, your treatment plan has been predetermined by some actuary that works for the insurance company that sits in a cubicle somewhere, and he's never met you. He's never looked at your labs. He's never looked at your medical history. He's never shot any x-rays or done any testing or anything, but he is going to be the one that's determining exactly what your treatment plan looks like. It's kind of crazy. So that's why when you go to a medical doctor, you're going to get about 7 minutes of face-to-face time with him. He's going to be pecking on his computer the whole time. And then the medical doctor is going to order a very narrow bandwidth of testing. He's going to order a very small amount of testing in order to arrive at a diagnosis, in order to justify prescribing a drug. In other words, he's going to do exactly whatever the insurance dictates that they will pay for, and nothing else. I guess they're just tired of fighting with people. Now, when I order tests for people, I order a gigantic amount of testing because I want to see the entire metabolic landscape and how everything is connected with each other. So, for example, how is the thyroid gland affecting the sex hormones? How are the sex hormones affecting the thyroid gland? How is anemia or blood sugar problems or cortisol, which affects the brain, or chronic inflammation or oxidative stress, or GI problems, or food sensitivities or intolerances, chemical sensitivities, stealth infections, autoimmunity. These are all things that can negatively impact your thyroid function. And, here's this hidden secret. It's very rarely the thyroid gland's fault. It's usually some peripheral thing that's going on in the body that's the driving factor about what's going on. And that is why only 17% of people taking some hormone replacement therapy ever get helped. That's not my opinion. That's the Academy of Endocrinology's what's published. So 17% of people out there are going to benefit. 83% of people are not going to get any help whatsoever. And so they're going to be better off looking at functional medicine and looking for an expert that can look at all the different things that can contribute to this problem.
Walking in first time into your office, chronic condition center, what happens for the initial visit to maybe some sort of a diagnosis? You're running a ton of labs, like you said, but when someone sits down with you for the first time, what can they expect?
Okay, so you're asking about my general workup. What am I going to do to arrive at the conclusions? Okay, so the first thing that we want to do is to gather some medical information. We want to look at your medical baseline, your medical background. So I have you fill out some intake forms and some questionnaires. And one of the questionnaires is a metabolic questionnaire, and that goes through things like how are you doing with your gut and your blood sugar function, your thyroid function, your adrenal function, the pancreas, the liver and gallbladder, the ability to detoxify, male sex hormones, female sex hormones, all these things. And then after that, we look at a neurotransmitter assessment questionnaire that probes about your central nervous system, your brain function. How are you doing as far as your stress response? How are you doing as far as your utilization of glucose in the brain? How are the different neurotransmitters functioning, like serotonin, dopamine, GABA, and acetylcholine? After that, then the next thing that I want to do is a consultation, where I will talk to the person. I'll say, what are your goals? What are your challenges that is in front of you, and what would make you happy? What can I do to try to improve your function? After that, we either do an exam or we will send them out for some lab testing to achieve like a metabolic foundational baseline to find out what's going on. And like I said, we will start off by ordering a lot of different blood tests and urine tests to gather some information. There's no one test out there that will give you 100% of all the answers to every question ever asked. The tests that I start with are very, very comprehensive, and people have told me it's the most comprehensive test that they've ever had. So once they have that, then I color code a test report for them. I put it into normal, functional normal, or lab abnormal. And from there, I have a really good understanding about the severity of the problem of what needs to come next, whether we need to test their food, how reactive that they are to certain foods, whether or not that they have a problem with their gut, whether or not that they have a problem with chronic inflammation, things like that. And then we will test and then treat, and then test and then treat, things like that. And it's a process, and it takes some time, but eventually we want to get rid of any kind of metabolic dysfunction in their body, move them closer and closer back to normal. That's a different approach than just giving them a drug and saying, I'll see you in a year. Have a good time.
In terms of genetics, a lot of people will say, well, your grandmother had this, your mother had that, therefore that's why I have this. How much of an emphasis is existing in the world of thyroid conditions versus triggers in the diet, toxins, stress? How do you see that shake out?
My experience has been that as far as the thyroid function, as far as weight gain or other types of things associated with this, it's about 95% lifestyle and about 5% genetics. There are some problems out there, some types of cancers, for example, that have a very strong genetic link. But when it comes to thyroid function, it's about 95% either environmental, or it's a lifestyle, or it's some kind of a peripheral thing that's going on with the individual, more so than a genetic weakness somewhere. There are some people that have a genetic weakness, but I'll give you an example. About 90% of everybody that has thyroid disease has Hashimoto's. Hashimoto's is an autoimmune disease. And what that means, in the simplest terms, is that your white blood cells that are supposed to be circulating throughout your body and protecting you from bacterial problems or viral problems or a parasite or something like that. With autoimmune disease, those white blood cells actually turn on your own body and they start attacking your own body. And if you ever want to understand the power of the immune system, wait till it turns on you. Wait till it starts attacking your own body. There are currently over 100 different autoimmune diseases that have been identified by medical science, and they are pretty much named based on which body part is being affected. So, for example, if the immune system is attacking and destroying the thyroid gland, that's called Hashimoto's disease. There's ones that affect the lung fields. That's called sarcoidosis. If it affects the joints, that's called rheumatoid arthritis. If it affects the colon, that's called Crohn's disease. Multiple sclerosis. That affects the brain. And so there's 100 different types of autoimmune diseases. And if it affects the thyroid gland, that one is called Hashimoto's. Now, there's a couple things I want to mention about autoimmune disease. Autoimmune diseases, you cannot cure an autoimmune disease. Once you have it, it's part of your genetic workup for the rest of your life. You can't switch a button and turn it off. There's no drug that can cure autoimmune disease. Now, while you can't cure autoimmune disease, you can put it into remission. So it's no longer causing damage, no longer causing mischief. So it's kind of like the dimmer switch in the chandelier where you turn the electricity down so that it gets really dark. Putting an autoimmune disease into remission is the best way possible to handle the problem. And the second thing I want to mention is that autoimmune diseases, they're kind of like a schoolyard bully. If he's picking on kids over here, he's probably picking on kids in other places too. So it's very, very common for people to have autoimmune attack on the thyroid gland, as well as the brain, as well as the gut, as well as the skin, etc. So it goes on and on and on. And so the first thing that I want to do is to rebalance the immune system, the different components of the immune system. And the second part is to identify and then eliminate all the different peripheral triggers that could be causing the thyroid gland to not work right.
If someone is listening and saying, well, I've been on thyroid pills for decades and I've never seen someone like, Dr. Smith, do you have an example of someone who was down that path and how you helped put into remission or better improve their life?
Sure. So let's say, for example, that we have a patient and they went to the doctor and the doctor put them on 88 micrograms of Synthroid per dose. And then that worked for a little while. Then after a year or so, then they had to boost the dose up to, say, 100 micrograms because it was no longer able to keep up with the demand. And then after about 5 years, then it's at 120 micrograms. And then it's at 150 micrograms. So as the condition gets worse and worse and worse, as the immune system attacks and destroys the thyroid gland, the doctors are going to need to increase the dose of that drug. So for any of your listeners that have been down that pathway, they started off at a relatively low dose, and then after a while, the doctors have to keep raising it, raising it, raising it. That's a sign that the immune system is getting worse and worse as far as the thyroid attack. And if that's going on, what I would tell them that just doing the same thing over and over and over and then expecting a different outcome is one person's definition of insanity. And so maybe it's time to try a different approach.
You had mentioned the insurance industry, which seems to dictate a lot of these traditional medical visits. When someone's coming to you, how does your, process, I don't know if it works around the insurance, but how are you getting the results? Can't they just say, we'll cover this if you, right? Why are they not on the same page?
That's $1 million question right there. So, people need to understand that the insurance companies don't care about you and don't care about your health at all. They care about their shareholders. And so they will pay for just enough care so they don't get sued. That's about it. So if you want to keep your chronic health conditions and keep everything as it is right now, just do whatever the insurance companies will pay for. But if you want some better service, better outcomes, you have to think outside the box a little bit. So the insurance industry pays for what I call the standard of care. The standard of care is to use some kind of a chemical to suppress a symptom, whether it's thyroid disease or it's one of the other things that we mentioned before. High blood pressure is a great example. So there is no pill in the world that's going to cure high blood pressure. It's never been done. They're going to manage high blood pressure. They have a lot of different drugs out there. They have beta blockers, calcium channel blockers, ACE inhibitors, diuretics, all these things, all these drugs out there that are there to manage the problem, but it's not there to cure the problem. By curing, I mean fixing it eliminating it and stopping it. So if you want to test that theory, just stop taking your pills. See what happens. Right? If you have hypothyroidism, if your thyroid is too low, you stop taking your meds, it's going to get out of control. I don't tell people to stop taking their blood pressure medicines because it could be life-saving for a lot of people. But you want to find out, why do you have high blood pressure? What's going on with your body that's causing this issue? Medical doctors don't ask that question. They just don't want to fix the problem. They want to manage the symptoms. That's about it. So you have to think outside the box a little bit if you want to look at this from a functional medicine point of view, because again, our mission is not to chase down your symptoms. It's to find the root cause of what's driving the problem.
For someone that they've had all 10 labs, right, like tests that you run in the lab, and there's no issue, but maybe there's something going on in their family, and maybe 5% of that it could affect them. There's things that people could do. Some people would think, oh, maybe a specific way you kind of rub your neck or what. Are there little tricks you could do to sort of keep your thyroid in better shape? What you eat, timing, things like that?
Well, nutrition plays a huge role in this. I'll give you an example. If a person is eating a lot of fast food, a lot of processed food, they're going to end up with a lot of chronic inflammation. And that's one of the triggers that causes the thyroid dysfunction. So I would just say, start eating like an autoimmune paleo diet. Start focusing on natural foods, non-processed foods. Stay away from dairy and grains. And there's a panel that I will sometimes test for called a food safe test. And that measures the person's body against how reactive that it is to being exposed to different foods. So you draw a couple of drops of blood from your fingertip and you send it to the lab. And the lab will measure that person's blood against 95 different food antigens, known suspects out there. And then it will tell you on a very nice bar graph how reactive that person is to that food. So the more reactive, the more chances of you getting really, really sick or having low energy or having some kind of a bad reaction. For example, I tested myself and I found that I have a problem with dairy. I have a problem with almonds, and I have a problem with crab. Every time I would go to like Red Lobster for like the all-you-can-eat crab leg thing, I would come home and get really sick, and I couldn't figure out what was going on. And then I tested myself, and all of a sudden it just clicked. And it's a very, very simple test. It's a very affordable test, and it can give you a lot of great answers. I had a girl that was about 20 years old. She had fibromyalgia. She was chronically tired all the time. She couldn't keep her head off the pillow. And she was in pain all the time. And her mom was trying to get her to eat very clean food. Because as a 20-year-old, they don't eat very well. And so her mom was making grilled chicken and green beans and fresh garlic. And I did the test, and she had a severe reaction to chicken breast and green beans and garlic. I'm like, you need to get her off of those foods. So the mom immediately took her off of those foods, and just like that, boom, the problems completely went away. She felt great and had no pain, no symptoms, her energy went through the roof. She could sleep throughout the night. And before coming to see me, she went to see all these different medical specialists. She went to see gastroenterologists. She went to see a neurologist. She went to see her pediatrician when she was a child. All of them put her on drugs that she had a severe reaction to them. And we identified where the source of the problem was coming from just with this simple little test.
That's so sad. It's like just to see like, oh my God, it could be so much easier, but the insurance kicks in. And how about, like, you mentioned gut, and I was curious too, because I don't think a lot of people would relate thyroid problems with gut, or maybe an even more unexpected, symptom that people don't realize this could be a sign that your thyroid is having issues.
So the gut can affect the thyroid, and the thyroid can affect the gut. So let me unpack those two. Every single cell in your body, all 70 trillion cells in your body, has a cell wall, and the cell wall has a receptor site for thyroid hormone. Every single one of them. So that means that the thyroid is one of the master regulators of your body. So, for example, if it's the gut and you have hypothyroidism, you're not going to have normal gut function. You're not going to be able to absorb food correctly. You're not going to have normal bowel transit times. So you're going to end up with either diarrhea or constipation, or both. It's going to ping pong back and forth. Your immune system, 80% of your body's immune system is in the gut. It's in the malt or the gult, the mucosa acquired lymphatic system or the gut acquired lymphatic system. So if you want to keep your body healthy, you have to have a healthy gut. Some of your neurotransmitters are made peripherally in the gut. So you need to have plenty of serotonin and plenty of dopamine to make the brain work. So if you're not making the neurotransmitters correctly, I always look at the gut for the root cause. The gut is considered your body's second brain. So when there's a brain problem with either depression, anxiety, nervousness, irritability, or brain fog, cognition problems, memory problems, I always look at the gut as the root of that problem. And if you take it back a step, that could be directly influenced by the thyroid gland. There's a relationship there. Now, when you have to have a healthy thyroid physiology, you have to have a healthy brain. So the brain requires some basic building blocks to make it work right. You have to have a healthy amount of serotonin. You have to have a healthy amount of dopamine. You have to have glucose, and you have to have oxygen. And if they're not present, you cannot manufacture thyroid hormone properly. You just can't do it. So there's a relationship between gut problems and thyroid problems. Now, taking that back a step, we want to look at if the person has leaky gut syndrome. Leaky gut syndrome or intestinal antigenic permeability syndrome is when you have holes in the lining of the small intestine. And when the bolus of food passes through there, instead of being absorbed properly, it passes through the lining of the gut wall directly into the person's blood system. And so the body doesn't know what it is. It starts to wonder, like, what is that? It starts attacking it. It starts to spin up the immune system. And that is the root of autoimmunity, largely in the gut. When you have an unhealthy gut with problems like leaky gut, you're also going to have a leaky brain. It's going to cause problems with the blood-brain barrier. And you're going to have a unhealthy lung. You're going to have leaky lung syndromes, and you're going to have pulmonary problems. So one can feed another. The body is not just a bunch of separate, indiscriminate parts. It's all designed to work together. That's why you can't rely only on allopathic medicine to look at the problem. It has to be looked at holistically.
And because a lot of people will say, this is what my insurance covers, like we said, whereas functional medicine, sometimes, I guess it depends. Where would you start with someone if they just had a minimal budget, whether that's what they're eating and or testing for, but someone that can't really just do hundreds of tests and finger pricks and urine tests and all that kind of good stuff?
So first of all, this is not expensive. This is very affordable. And there's a lot of different options that we have out there for people, that ranging from really deep discounts to things like care credit or financing, where you can still have low monthly payments to still keep it within your budget. Very, very common. To answer that question, you don't have to do all the tests all at once. You can spread it out over time. So typically we'll start with like a blood test or urine test to get a medical baseline, a medical foundation. And then from there, maybe we'll move on to do some food allergy testing. And then from there, maybe we'll go on to do some stool testing to see what the condition of the person's gut is. Inside the gut, there's a thing called a microbiome. I don't know if you've ever heard of that, but that's the ecology of the bacteria that lives in your gut. You've got about 70 trillion cells in your body, and you've got about 10 times more than that of bacteria that lives in your gut. So that bacteria is there to properly work on the food, make sure that it's absorbing properly, process waste products for the bowel and bladder. It's there to help make sure that you're producing plenty of neurotransmitters. It's there to make sure that your immune system is in good health. There's a lot of functions of the microbiome. I just did some research. I just read some research where they're linking an unhealthy microbiome to early onset dementia. And so, and blood sugar problems, that's largely related to the microbiome too. All these things can be done in stages. It doesn't have to all be done right away. It can be done over time. But the thing is to get started somewhere. Just as long as you're getting started, that's the most important.
And what about the future? Obviously, people, different treatments, different testings. What do you see on the horizon for thyroid testing? What's in the works that you've read that could change how we treat and prevent further deterioration?
So there's a lot of things that can be done for these problems. I always go back to the basics. I always go back to the fundamentals with people. Thyroid problems affect more women than men. Statistically, it affects 8 times more women than men. So beyond that, I would focus on nutrition. I would focus on getting plenty of sleep. I would focus on getting plenty of exercise. Exercise is more so than just making sure that you're fitting into your genes properly. It's about balancing your hormones correctly. And it's about making sure that your nervous system is in good working order, and that's where chiropractic would come in. It's about working on making sure that there's no nutritional deficiencies or that you're taking care of absorption of your nutrients pretty well. And so all of these goals has a certain solution. So it depends on what the problem is. I mean, this is not cookie cutter. This is a highly individualized, patient-centered approach to healthcare. And so that's another thing that's different from the PCP is that that's just one size fits all. It's like a hamburger from McDonald's versus a filet mignon from Ruth's Chris Steakhouse. I mean, technically they're both meat, but that's kind of where the similarities end. So I'm not offering the standard of care. I'm offering exceptional care for people that have a problem that have not gotten the solution with traditional medical care. They need to look at functional medicine as another step in the right direction. I mean, there's a lot of things that can be done to fix a healthcare problem. It's kind of like cooking an egg, right? There's more than one way to cook an egg, just like there's more than one way to fix a healthcare problem. Drugs are one approach, but it's not the only thing that's available to people.
I was also reading, you have a book that's coming out soon. Can you talk about that and what people could expect?
Yeah, it's a long time in coming. I edited it down a lot. One 8.5 by 11 page of text is the equivalent of 3 pages in a book. And so my chapter on gut health was 100 pages typed. So I had to edit that down to 10 pages. I'm in the process of, it's about 98% of the way done. And when it's ready, I would be happy to send it out to any of your customers. It's in a PDF file, or any of your listeners in a PDF file, so they can learn a little bit more about what I do and see if it's within their paradigm to try to get these problems corrected.
So that's coming out maybe this year, next year?
I don't have a specific date. As fast as people can get it edited, that's that stage. And this is the second book that I've written. The first one came out about 2010, and it was about chiropractic and where I was with my journey at that point. I've since focused. This is all about functional medicine, about thyroid care, and about getting rid of aches and pains and root cause type of approaches to fixing problems.
If someone wants to connect with you, though, in the meantime, what would be the best place to start?
Well, you can visit me online at integratedthyroid.com, or you can also call me at area code 412-595-7332. And if you call me, we can set up a free discovery call. And that's where it's like a 5 to 10 minute phone conversation where you can tell me about your problems and things that you've tried and see what my best recommendation is. If I feel that I can help you, I will recommend just to fill out some preliminary paperwork, just so I could get a better look at what's going on. And then it's called a case review, where we dig a little bit deeper. We ask some questions about what can we do to try to fix your problems rather than just masking the symptoms. But again, I would just call me. Call me at area code 412-595-7332. And let's get going.
Yeah, I'll put that in the show notes so people have it as well. But thank you so much for your time today, Dr. Smith. It's been really great to get to know you and to learn just so much about the thyroid that really helps me, because I, again, have a lot of friends and family in this boat, and it shed a lot of light, made a lot more sense to me.
Thank you for having me. It was a pleasure, John.